The planning process for disasters in our community has involved identifying what are called emergency dispensing centers. These are locations where the civil authorities and the medical professionals can deliver to a population needed medication, immunizations, or examination and evaluations. So, in our community, the structures that we've identified are the ones that are big, are easily accessible, and those tend to be our schools.
When the Worcester Public Schools came to the table with the other emergency management systems and discussed what would be required to have emergency dispensing sites, as they're referred to, we were told and it was determined that you would need a place that is centrally located, where you need to look at people arriving both in vehicles and would have the appropriate parking, as well as people having no type of transportation that could walk to a facility within a reasonable amount of time. We also have to look at the layout of each building that would be required to serve as an emergency dispensing site and have various types of egress and have obviously a lot of rooms available to do many types of pre-screening before the individuals come in to receive treatment could get that at the centralized location within that building. Also, we would need to have an infrastructure in place where we would have to have public safety vehicles on board. We would have to have managed traffic respectfully. We would have to have all sorts of public agencies around to where they can work cooperatively with our public school personnel that would be the coordinators of such sites.
The idea to use the school system as a means to distribute vaccines or antivirals such as Tamiflu really stems from the Centers for Disease Control, their bioterrorism program that they implemented back in 2003. And that system, in essence, for the city of Worcester, we have 9 pre-designated what we call emergency dispensing sites, and these will be stood up. We need approximately 3,000 volunteers to help staff these dispensing sites. We would receive the stockpile of antivirals or vaccine if and when it becomes available, and then we would go ahead using public education, public information to allow the public to enter these buildings where we would distribute these drugs.
But in order to make it work, disaster planning needs to include educating the general population as well as putting together plans for the disaster responders, the doctors, the emergency technicians, the firefighters, the police officers, the National Guard.
We think about responding to a pandemic and the health and medical component. But what about all the social disruption that creates by not having enough food in the supermarkets, not being able to have power because the local utility companies, their workers are ill and they're at home. So those are the other instances that we have to start to plan for, and we start to pull together those organizations to start to talk about how they should be preparing their organization for a pandemic.
I can't stress strongly enough the importance of citizens of the community to be active participants in this process.
We are urging teachers and educators in the public schools to store food and to be prepared, especially for medical needs that they might have, for water, for canned materials and whatever. Yes, we are recommending that they do that.
Some of the things that I've done to prepare is I started each week going grocery shopping and picking up just a few extra canned goods, some non-perishable foods like cereals, rice, cereal bars, granola type things, dry foods like crackers, some powdered milk, some canned milk. I was thinking of my daughter when I decided to get the canned milk. She drinks a ton of milk every day. I picked up some juices and some fruits, some vegetables. Then I thought about, well, if we have enough of food, what are we going to do in terms of if we got a cold? So possibly we needed to get some extra medicine to keep on hand, not just your average amount of painkillers or cold medicines, but some additional ones. So I started to do that. I also thought about hygiene, some extra shampoos and soaps and toothpaste. I just think that the more people that are aware, the better off we will all be. If we all work together as a community to help one another, it will work in a better way for all of us, for everyone involved.